right, everyone, thank you so much for joining us here today. We are here with representatives from the Department of Emergency Management, the Department of Public Health, and our San Francisco Airport, and other city agencies to talk about the city's preparedness for the coronavirus and to let the public know that San Francisco is ready to respond in order to ensure public safety. Since the first outbreak in China, we have been monitoring the situation and taking appropriate steps in order to address the challenges. And I want to be clear that there have been no cases here in San Francisco. And we'll continue to work with our partners, the state and federal agencies, to track progress and provide multilingual public information as well. The Emergency Operations Center has been activated here at the Department of Emergency Management. Now, I know that there have been a number of rumors coming of a flight coming to San Francisco with diplomats from China, and our latest understanding is that there are no incoming flights that we have been made aware of. And this is, of course, an ongoing situation, and if anything changes, we are prepared to take the necessary steps to address it, and we will make sure that we notify the public every step of the way. So at this time, we have a number of our department heads that are here to talk specifically about their role, what we are doing and what we will continue to do. And I want to thank you all for being here today to help us get the word out so that the public is aware of the facts in the situation and here in San Francisco. So with that, I want to start with the Director of Emergency Management, Mary Ellen Carroll.
Thank you, Mayor Breed, and thank you all for being here. The city has been working with our local, state, and federal partners for almost the last 2 weeks since the initial outbreak in China. These partners include the CDC, the State Office of Emergency Services, Department of Public Health, and SFO. Today, you are all here. Welcome to the Emergency Operations Center for the city. We have activated the Ops Center and basically to ensure our readiness to respond. It's the role of the EOC to provide situational awareness and to coordinate resources and information. We will be broadcasting in partnership with the Department of Public Health information about how to prevent the spread of the virus and what to do to stay healthy during flu season. And so with that, I'm going to introduce Dr. Tomas Aragon from the Department of Public Health.
Good afternoon. My name is Dr. Tomas Aragon. I'm the Health Officer of the City and County of San Francisco. The San Francisco Department of Public Health is working closely with the California Department of Public Health and the Centers for Disease Control and Prevention to closely monitor this new novel coronavirus, which originated in Wuhan, China. This issue is rapidly evolving and changing. It's important to recognize that there are no confirmed cases in San Francisco at this time. We are actively preparing for the possibility of confirmed cases. We have activated our emergency response plan specifically for this type of scenario. This is what we do in public health. We have a lot of experience responding to outbreaks. We are in touch with our healthcare providers, our hospitals, our regional, state, and federal partners as we implement protocols on how to identify potential cases, how to isolate them, how to test them, and how to make sure that they do not infect others. At this time, residents of the Bay Area are at low risk of becoming infected with this new novel coronavirus. Unless they have been recently to Wuhan, China, or have come into contact with somebody who's a confirmed case who traveled to that area. It's important to recognize, especially at this time of year, that we can still do simple things to protect our health. For example, making sure that we wash our hands, that we cover our coughs and sneezes, and that we stay home if we're sick. It's not too late to get the flu shot and to help prevent illness and symptoms similar to the novel coronavirus. At this time, I'm going to turn it over to our colleague from the airport, Mr. Ivan Sotero, who's the director of the San Francisco International Airport, who will give us an update on what's happening there. Thank you.
Good afternoon, everyone. Ivar Sotero, Airport Director. We continue to work closely with our federal partners, CDC, and our Customs and Border Protection folks. And although the flight from Wuhan was canceled, all departing flights out of Wuhan, and there was a direct Wuhan to SFO flight, and that ceased operations last Thursday, we still have a presence by CDC at SFO for any lingering folks traveling into the U.S. through SFO in the event their itinerary also included a stop in Wuhan. And we are also monitoring the State Department flight out of Wuhan, and the latest information we have is that flight will arrive to the U.S. via Anchorage, and then it will make its way to Ontario, California. With that flight, there will be 3 health checks along the way. The first health check will be by Chinese officials for passengers boarding the plane. The second check will be by U.S. officials on the aircraft that flew into Wuhan with that flight, and we'll do a second health check before departing. And then there will be a third health check on the arrival of that flight into Anchorage before allowing entry into the U.S. And then it will then be cleared to fly to Ontario. So we will be continuing to monitor this, and certainly will be notified if there's any changes about this flight as it makes its way to the U.S. And I understand it will be departing sometime, I think tomorrow. Thanks.
All right, so that concludes the information that we have at this time.